and welcome to the CAFMA Connect. I'm your host, Fire Chief Scott Freitag, and with me again this week, or back this week, I guess, Assistant Chief John Feddema, fresh off of your trip to the Mighty Oaks, this time in California, last time Texas.
Yep.
How was the trip? You talked to me a little bit about it, but let's start the conversation today with that.
Yeah, it was good. The trip, there was 22 participants in the program.
Okay.
It was a week long, and just it provides an opportunity for folks to come in and kind of usually unload some of the burdens that they walk in with.
Right.
And there's different topics that are discussed along the way, and there's different breakouts throughout the whole process. But it was a great experience. I was there as the second phase of a leadership process to step in there as a team leader, which really just means you go in there, you teach a portion of a class, and then you help lead a breakout, which again is not necessarily not fixing. You're helping them move to focus on something outside of the trauma that's brought them in. Mm-hmm. And so there's a lot of leadership training that goes along with that, but good experience. And I think I enjoyed the time, and hopefully the folks that attended got something from it to help strengthen their walk moving forward. Well,
and I want to key in on something you said. You don't fix it. And I think we look at behavioral health in a bigger sense, right? I can fix a car.
Sure.
Something mechanically wrong, I can fix that. A doctor can fix, or at least try to fix, my shoulder. But fixing someone that has some psychological traumas that they're dealing with, all we can do is guide them.
Sure.
Right? There's no fix to this. It's a guide, and then that person has to make choices.
Yeah. I think again, it's providing them the opportunity to unload. One of the things they talk about there was, people walking with a rucksack. Originally, the program was designed for veterans. They've expanded it to first responders, but they talk about a rucksack that you walk into the program in. And the first question, it starts on a Monday evening. The first question on Tuesday morning is, do you want to get better?
Right.
And part of that getting better is to unload all the stuff that you've packed into that rucksack, you've packed into the depths of your heart that you never get out. And there's an environment that is created to help unload some of that stuff.
Right.
And the whole goal is to get through some of that during the week. And again, it does help people navigate that process, not necessarily trying to fix. If you say, hey, I got this challenge, it's about trusting the process throughout the end of it, and the different curriculum you go through, the different resources that they have, and again, helping people unload that.
Right.
A big part, we can't reach in and pull that stuff out for you. You have to be willing to do that for yourself.
Right. No, and that's a great program, and I'm so happy that you are taking part in it. I know when they first asked you came to me, and I said, absolutely, let's support it, because you're bringing that information and training and the things that you're learning back here. And the cool thing, from my perspective, I'll just put it out there, is not just the behavioral health standpoint of it, but I would love to go through what you have to go through to present there.
Yeah.
Because it challenges you to be better in your written communication, be better in your oral presentation skills. And so there's so much more development there for the people that are providing some of that guidance than just the behavioral health component. And I really appreciate that, and I'm glad you're taking part in it. Yeah. And not that you have a problem with your presentation skills, because that's not the case. I just think anytime we can get more education in certain areas, it'll certainly help us.
Yeah, and I think we've talked about it before, but the education to my presentation was I had to present it several times before I ever went there, before I ever presented it in person, because there's specific things that they want you to cover. And there's some leeway in terms of your own information that you kind of add in there, but there's some core things you have to cover.
Right.
So you have to teach it several times before you ever do it. And in that process, there's also, you get evaluated. So there's a level of vulnerability when you walk up there, like you have to be willing to teach it and receive that feedback.
Right.
After you teach, then you sit around with the other leadership group and you go around and critique the class the following day. And it's expected that you help critique somebody else's and you receive that critique for your own. And there was definitely some very specific things like, hey, sustain that, keep that for the next time. And there were some other things like, you know what, think about tweaking that a little bit, adjust this. Hey, you didn't realize it, but during the course you did this. It's like, yeah, if somebody would not have pointed it out,
right,
I never would have made the change. I never would have improved it for the next time. So, like I say, I think it's been very helpful in helping just improve my presentation skills. But at the same time, the humility that it takes to sit there and do that only builds the strength of that leadership team.
Yeah. Well, I'm glad you had a great week. You had to come back. Then we went straight to fire school, and we had the healing field last weekend, which went very well. The healing field is still up. So for those in the community who happen to catch this, by the time this comes out, it'll come down. But next year, this time, you can go out and just, it's important that we remember history, lest we forget it and have to repeat it. Yeah. So, to go out and especially bringing, I was talking to my physical therapist today, and she didn't come to the healing field. She went to Hope Fest, but she has 2 smaller kids, and she took the kids with her. Yeah. And I think that's so important to introduce the kids to what was 9/11. Yep. It was well before you were born, but why is this important today? And why will it be important to the history of our nation? Yeah. So we're going to talk about mandates and choice here in a minute. And Jonah, I have an idea for you for the little thumbnail this week to try to, kind of a clickbait thing. We'll try something new, see if we can get it. But the first thing I want to touch on, and this is going to be in the review this week, is that Thursday morning this week, we closed on the COPs, the certificates of participation. Yep. There are still some folks who are confused as to what that means. We've written about it extensively in the review. We've actually talked about it on here before. Mm-hmm. Let me just point this out for clarification. We are not taking on an additional $53 million in debt. Sure. We're refinancing the debt at a lower rate, thereby saving taxpayers over $21 million of the life of the loan. So it's not new debt, it's refinancing old debt that exists in the retirement system. Yeah. Anything else that you have on that you'd like to clarify, or is that pretty good?
No, I think it's good. And I think, like I say, it stabilizes that payment. Where in the past that we had that the payments continue to escalate and then balloon out to what would be unachievable in terms of that payment. This, like I say, stabilizes it. It'll go up a little bit over the next 2 years, but then it levels out, and we maintain that level, and that level is sustainable. And I think that's the big takeaway as they were going through the whole process was this creates a sustainable payment, and it reduces that overall amount.
So mandates and choice. The president came out last week, Thursday, and mandated businesses with that employ over 100 people. They have to either vaccinate or they have to be tested weekly. We are not a business. We are over 100 people, but we are a local governmental entity, and therefore that mandate doesn't apply to us. And even if it did, we wouldn't follow it, just in case anybody was wondering. So CAFMA will not mandate that you have to get the shot. That is a personal medical choice. Yep. That we've discussed as senior staff, and we've made the decision that we're not going to mandate. Then I sent an email out to this effect, but then there were some follow-up questions that I think are important to bring up. So the federal government said, well, if you're contracted with the federal government. So the question was, when our folks go on a wildland fire for the feds out of state, is that a requirement for them? The fact of the matter is we are contracted with the state of Arizona. Sure. The state of Arizona is contracted with the feds. We are not. We fall under the state's rules. As of September 29th, Governor Ducey's law goes into effect that prohibits us from mandating vaccination. Yeah. So, and let's be clear, this is like a flu shot. It's a virus. There's going to be multiple different variants. Mm-hmm. That shouldn't be a surprise to anyone. That's science. Nice. From experts. So, those are, we're not going to require it. We're just not going to. The other one was, will DHS require it for paramedics? And the answer to that is no. And the reason is DHS is part of the state of Arizona, and the state of Arizona has passed a law that says you don't do this. Yeah. So could the feds try to take a run, another end run.
Sure.
Absolutely. They could go through OSHA. They may have. Don't care. Our position is now and will remain, this is a personal choice.
Yeah.
So is there anything that I wasn't clear on?
I don't think so. I got nothing to add.
Yeah, nothing. I said some things at the Healing Field this weekend too, because there was a statement that this isn't about personal freedom. This is about safety. And I'm going to counter that and say, no, this is about personal freedom.
Sure.
Because the science, there seems to be a rush to judgment with the science, because what you hear, the pushback you get is, do you not believe the science? Well, what science are we looking at? Because there's long-standing science that relates to my immune system. There's long-standing science that talks about, hey, you know what? You need to exercise and be healthy in these things because that prevents or can help prevent, not always, but can help prevent diabetes, cardiac, lung issues. Mm-hmm. I mean, when I was growing up in school, I can't remember the name of the program, but you had the healthy fitness program that was federally supported. Yeah. Do you remember those?
I don't remember the name of it, but I do remember it, yes.
So, and you'd get like a little patch or something if you did really, I didn't get one. But, there's science that supports, hey, you need to do these things to be healthy, and healthier people do better when they contract COVID than others. There are anomalies, obviously, to that.
For sure.
There's science related to masks that have been around for years. After the Spanish flu in 1918, after it was all over with, the studies showed, hey, these masks didn't help. Why didn't they help? It didn't slow anything down. And you're seeing a lot of the studies today, actual validated studies, saying there's no statistical difference. This really isn't working. And if you think about the fact that, when you're driving around town, John, how many cars do you think you see with one or multiple masks hanging from the rearview mirror?
So there's a lot, yes.
Yeah. And aren't they disposable?
You have to keep buying them. So
yeah, that's true. You do have to keep buying them. But people are picking them up off the floor of the car, out of the back seat, pockets, purses. Yep. All of those things are contaminated. And the side of the box says doesn't prevent viruses. I read them because that's what we have in our engines.
Sure.
And that's what the side says. So again, mask preference. Decide if it makes you feel better to wear it.
Sure.
If not, don't. There's a reason that our infectious control protocol requires an N95 mask.
Correct.
That has to be fitted on an annual basis.
Yep.
And also has to be cleaned in our cool little UV light boxes.
Yeah. And I think those are utilized in short duration incidents where you respond into the incident, you're dealing with the affected patient, and you leave. Or you treat that patient, you move them to the ambulance, you move them to the hospital. It's the short-term exposure.
Right. Well, and I'm no expert. However,
I would never argue that.
Yeah, that's true. When I see people in a clinical setting, for example, they put a mask on to go into a room or a clinical environment, meet with a patient. Well, technically, you're supposed to pull that back off, dispose of it, and replace it to go see another patient. That's not happening.
Sure.
So, it's not that we are COVID deniers. We're not denying COVID. COVID it can be very bad for a lot of people. Yep. We're not denying COVID. The approach that's being taken is questionable on the mask side of things. On the mandating the vaccine side of things, there's not enough science there yet, especially with the new variant, because I just read a study out of Britain the other day that said, hey, this may be contraindicated. And that's not the first study that said that with the Delta variant. And the FDA has a number of people leaving, and they wrote a paper on their way out that said, look, you're rushing to boosters, and there's no evidence for this yet. We haven't done any studies on it. Yeah. So the thing about science is it plays out over a period of time.
Oh, yeah.
My concern is rushing into something. Israel has the highest percentage of population that is vaccinated, and their cases are going crazy.
Sure.
So what's the answer? I don't know, but I can tell you that what's happening right now, what we're doing, isn't working. So let's focus on the treatment. When we talk about numbers, why don't we start being honest with the numbers? How many people have COVID but have very minor symptoms?
Yeah.
How many are hospitalized? How many people died as a direct result of COVID? How many died who simply had it, but it wasn't a direct result? Because all of those numbers are being jumbled together. Sure. And again, not a COVID denier. I think you need to wash your hands. I highly recommend you don't lick other people.
For multiple reasons.
It's for multiple
not
reasons.
Not just your own health, but
especially people you don't know. I mean, it's just weird.
Law enforcement may get involved if you have people you don't know. Even people you do know, that could be a problem too.
Yeah, you should be concerned. I mean, I wouldn't walk in your office and do that to you.
No, if you did,
yeah, then we'd end up in HR. It'd be a thing. But it's those types of things that seem to work. I know you work out every day almost. I get up in the mornings and work out before I come in. We eat fairly healthy diets. I take a lot of vitamins that include zinc and vitamin C. And, honestly, I don't know what all I take. My wife just puts pills out in the morning.
It's dangerous.
She could be slowly trying to kill me and I wouldn't know. So if I disappear, something happens. Yeah.
Perfect. Do I send her a card or do I go question her? Like, did I thank you? Or
I think she's going to get a lot of thank you cards, honestly.
Yeah. Why am I going over there again? Yeah.
Yeah, that's just my thought. But I don't know everything I take, but there's a lot of them. So, but I think one of the keys is, be healthy. If you're immunocompromised, you should take precautions, whatever precautions you deem necessary. If you're going to wear a mask, wear the appropriate type of mask and wear it properly, dispose of it properly. The one that's on the floor of your car is not usable.
Sure.
Those types of things.
And I think, like you say, the people that are at highest risk need to be the ones protected. And
right.
I think we need to be careful assuming that throwing the mask on all of a sudden gets rid of any concerns. It's no different than you watch the fire service. As our turnouts got better and better, we went farther and farther into the fire.
Right.
And we started hurting more and more people that way. Just because you have a mask on does not mean that you're protected at that point.
No.
It provides, as we already discussed, a very maybe minute level for a short duration. And your best point at that point is especially protect those who are most vulnerable.
Sure.
And it might be limiting that exposure versus thinking that you throw something on your face and I'm good to go wherever I want.
Right.
It's like you say, it's a virus and very difficult to, and we are yet to do it, to slow the spread.
Well, and when you look at SARS viruses, from the history of SARS viruses to today, and I wrote about it before, we've never eradicated one.
Sure.
So it's highly improbable that you're going to eradicate it. It's important that we do what we can to slow it down.
Oh yeah.
But there really just isn't enough actual science behind it yet to figure out exactly how we do that, other than, hey, we need to focus on our health more. Mm-hmm. We need to focus on hygiene more. We need to focus on, any number of things. But cowering in fear, which is what's happening a lot, cowering in fear and allowing life to pass you by is not how you live.
Sure.
And like you said, focus on those folks who are most at risk. Yeah. Take precautions for that. And I mean, I've been to conferences over the last several months. I've been on airplanes wearing a mask I know wasn't doing anything for me or the person next to me.
Sure.
I mean, I couldn't spit on them.
That's a good point.
And I couldn't lick them.
Again, probably a bad idea. But
yeah. So, I mean, from that standpoint, but I also couldn't smile at someone.
Sure.
A little kid running down the aisle on the airplane. Yeah. Typically, I'll smile at him and wave. Excuse me. And I couldn't do that.
Yeah.
And I spent 10 hours on that stupid plane because of diversions and sitting on runways and all this other stuff and eating my little pretzels they gave me. Mm-hmm. We're just doing some things that don't make sense. and we should really pump the brakes, take a step back, and see what does work, because we get the best solutions when we bring people with differing opinions to the table and we collaborate, which is the strangest thing, because in COVID, it's been the complete opposite direction. If you don't agree with the narrative, then you're obviously not an expert and you're anti-science.
Sure.
Well, no, there's just other science here that we should take a look at and that we should listen to and shouldn't be censored, Zuckerberg. I don't understand that. So just some things that we want to look at. But for our personnel, when the president comes out and says, I'm going to mandate this for you, and I'm losing my patience, my response is, it is about freedom, and I've lost my patience.
And I think that's what needs to be protected above all else.
Yes, it really does, because it's crazy.
Yeah.
That I want to go see the 911 memorial, the museum in New York, but I'm not allowed to go because I have to have a vaccine passport, which I think there's some federal laws about commerce and being able to travel, but I'm not an attorney. What our attorney said to me was, this is unconstitutional.
Sure. And
I would not recommend that you follow it, but it doesn't apply to you anyway, so you don't have to.
Yeah.
And if they try a backdoor route, well, it's still your personal choice, and it's going to remain that way.
Sure.
So I know you guys couldn't make it to the healing field on Saturday, but this kind of commentary may or may not have come across in my remarks that evening. Not quite this pointed on this topic, but in general terms, I did challenge people, because what I'm seeing today, and I know we've talked about it before, is people just aren't being nice to each other.
Sure.
And we don't honor the memory of those who died on 9/11, whether the innocent victims or the firefighters, police officers, law enforcement, military. We don't honor their memories by giving up our freedoms and taking shots at each other.
Yeah.
We honor their memories by remembering that we're Americans, we're American citizens. People, I don't know if you know this, people will try to swim across oceans and rivers to come get just a taste of the freedom that we have here in this country. I haven't seen anybody trying to swim across an ocean or river or even get through the northern border checkpoint to escape the freedom we have in America.
I don't know if some of our folks have the resolve to do that. I don't know that we've built that enough.
I'm
glad they don't want to.
Sure.
But at the same point, I don't know that they would make it very far off.
I'm kind of disappointed in some of our Hollywood folks that keep promising, if this happens, I'm moving to Canada. You're still here.
Mm-hmm.
You haven't moved. I know you can afford it. Go. But, you know, that the opportunity, or the 20th anniversary commemorating that, for me was vitally important. And really it was a time to reflect on who we are, who we should be.
Sure.
And I think today it's who we should be.
Yeah.
And I challenged people that night at the healing field, and I said, you know, it's great that you're out here tonight. It really is. And you're American patriots. I can see that by the spirit we have here. But I want you to do a gut check. Is coming here tonight akin to you going to church one time a year on Easter?
Sure.
Or are you living your best life day in and day out?
Yeah.
And I think that's the message to people.
Sure.
So that, and dude, be nice.
Yes.
And don't lick people.
Yeah. Words of wisdom.
Yeah. There you go. So I have made you quite uncomfortable enough for one session.
It's par for the course.
Yeah, that's true. That's true. But I did make Jonah laugh.
Yeah, perfect.
He thought it was funny. So with that, we will end this week. We are looking for ideas from anyone, really, about how to spruce this up. We want to maintain the American flag because
well, yes,
it stands for freedom. We're not getting rid of the American
Correct.
flag. And Damien made it for us, if you saw the podcast last week that Jonah put together. Nice work, Jonah, on that, by the way, on the 9/11.
That was awesome.
That was great. So we're looking for ways to spruce it up and bring more people into view. And some of that is what Jonah described as clickbait. So I have some ideas for him.
Perfect. And
right.
other guests.
And
that just helps.
It sometimes it does, and sometimes I just like the banter between you and I.
Perfect.
And I like the look on your face when I start going down this rabbit hole, and you're like, oh no.
I'm just going to sit here quietly and smile.
Plausible deniability. I didn't respond to that.
Yeah.
So awesome. Jonah, thank you again this week. John, thanks for being here.
You bet.
To all of you out there, live your best life every day. And for all of the CAFMA employees, you are not mandated to get the COVID shot, and you will not be mandated to get the COVID shot. That is your choice, not mine.